Here we go. Welcome, everybody, to another big idea. I'm your host, Dr. Jeffrey Hanna at Cervical Chiropractor here in Spokane, where what we talk about is how a very small problem that can happen in your body where your head meets your neck can have very, very profound impact on the health, well-being of your body in ways that you never would realize is actually associated with that area. And in this particular video, this I would argue is actually going to be one of the most important videos that I've done, because this is going to be one of the most common questions that people ask. And that's going to be to the effect of, why is it that I can have a problem in my body no matter what it is, whether it's headaches, concussion, whiplash, vertigo, dizziness, brain fog, full body fatigue, chronic fatigue, fibromyalgia, neuralgia, whatever it is. Why is it that it happens now, and how is it possible that we can identify that was the result of an old injury in the past? So if this is going to be interesting, and if you find this is the case, it's like, please, I'm going to ask this one right off the bat. Hit the like, subscribe, share this one with your friends, with your family, because this one here, out of all the videos that I do, talks about one of the most important things that goes on in your body. Because if we understood and we knew what I'm going to share with you right now, it would make an absolutely profound impact in terms of how we take care of ourselves as human beings, in terms of how we can do better with our friends, family, community, nation, world. You can imagine what that would look like. That's what the big idea is all about. So here, first and foremost, we're going to be talking, as we said, about the nature of what goes on when a person has physical injury in their body. So we are familiar and we know, okay, if we break something, if there's bleeding, if there are dislocations, you know what? We need to take immediate kinds of action. And this is going to be stuff like car accidents or really nasty sports injuries, different kinds of things like that that can happen from when we're just little kids growing up all the way to when we're full adults, even well into our 70s, 80s, and even 90s if we experience things like falls. Point being is we are aware if there are major traumas, and we take the appropriate course of action. And when the signs and symptoms are obvious, we know what we need to do. We need to go to the emergency room. Now, what I need to bring to your attention here then is for those many significant kinds of injuries that may not require immediate medical attention, but can nevertheless compile and cause a lot of very significant problems over a period of time. So I want you to imagine, you may have heard a story, it goes something to the effect, it talks about the principle of compound interest. There's a peasant who saves the king's life. And the king says, as a reward, what would you like? And what the peasant says, just a lowly farmer, but wise beyond his years, is he says, my king, all I would like is, I would like to receive 1 penny. But what I would like is I would like to receive double that every day for 30 days. And a lot of people in the king's court, they say, okay, this sounds absurd. This guy, he saved the king's life. He's not going to get really much at all here. But what happens if you take a penny and double it in 2 days? What do you got? You got 2 cents. 3 days, 4 cents. Keep going, double, 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 double. After 30 days, you've got $4.3 million. This is the effect of compound interest. This is the effect of momentum, and also showing how a very little kind of thing over a long period of time can actually build and cause a whole bunch of different issues. So I repeat, when a person's had a physical injury where it's obvious and they start experiencing immediate signs and symptoms, they know exactly what they need to do. But the vast majority of physical injuries that happen to people happen at a much smaller level. They don't necessarily break, dislocate, destabilize, or even cause any bleeding or bruising or boo-boos whatsoever. So the trips, the falls, learning to ride a bike, learning to play sports, learning to drive a car, having too much fun when you're a young adult, the accidents that happen when we are older, your body keeps the score. And these things can accumulate over a long period of time, depending on an individual's genetics, their anatomy, their individual stresses, and their individual life circumstances. Some people might experience immediate symptoms, and other people might experience symptoms weeks, months, years, or even decades later that they never think are actually related to any kind of physical injury from the past. And this is one of the reasons, the major reason why, as an upper cervical chiropractor, I advocate when people have had physical injuries to the body, even if it seems relatively innocuous, even if you're not experiencing any signs and symptoms, it is so terribly important that you make sure that everything is actually working right in your body so that a little thing cannot add up over a long period of time. And this arguably is one of the very most important illustrations that I can ever share with anybody to illustrate this point and purpose. You see, we are born perfect. Your body is designed to win. It's strong. It's resilient. And we start life at 100%. But what happens is over life, things take away from our 100%. And we're told, listen to the subtle signs that your body will communicate. Well, what does that actually mean? That's what this slide here is actually going to show you. In the beginning, what happens is a person usually just says, oh, I'm having a little bit of an off day. I don't quite have the energy. I'm not quite feeling myself. Or it affects our mood. We're either agitated, we're anxious, we are irritable, any number of different things. We're having a bad hair day, whatever that might be. That's usually the first subtle sign where your body's saying we're not in equilibrium. And there's some kind of an issue or problem going on. We need to identify what it is. And if that problem does not go away within 3 days or it becomes a perpetual cycle over a 3-week period, guess what? That's a hallmark sign something is not quite right. Now, unfortunately, what do people usually put it down to? A little too much stress, a little too much stuff going on in my life. I just need a bit of a holiday. And so they dismiss it. Now, what happens is if your body, or if you ignore what your body is trying to say, well, guess what? It's going to have to up the ante a little bit here. And it's going to start to affect how you are able to function in your day-to-day. Yeah, you can still do all of the things that you're normally doing, but you find that it's just that little bit harder. You don't have quite as much energy. You don't recover quite as well. It's not as easy as it used to be. Now, what do people say? They put it down to, I'm just getting older. There's nothing that I can do about it. That is not the case. Who here knows people who are still well into their 60s, 70s, 80s, maybe not doing things quite as well as they could back when they were in their 20s, 30s, 40s, but still living life? So point being is just because we are getting older does not mean, and that is not an excuse for us to stop living. It's usually because we are ignoring something that our body is trying to tell us that we need to take action in order to rectify this. And all the while, what's happening is that negative momentum is starting to accelerate. And as it continues to accelerate, it gets to the point where it starts affecting some of our daily functions. We're not sleeping as well. When we get sick, we A, get sick more often, and B, we don't recover near as fast. And we start to sit or experience subtle little warning signs, a little blip here, a little bit here. And again, we put it down to normal aging or normal stress. We get headaches, we get migraines, we get episodes of sciatica, we get episodes of intermittent pain, balancing kind of stuff, digestive issues, breathing issues, heart issues, skin issues, any number of different things. These are warning signs your body is trying to communicate that something wrong is going on. And you can see that as you are ignoring the signs and as that negative momentum continues to accelerate, things are getting louder and louder and louder until the point where you can't ignore it anymore. Now, here's the thing, is by the time that a person starts experiencing overt pathology, that is something that shows up on a blood test, on an x-ray, a CT, an MRI, or something like that, you have usually lost upward of around 50 to 70% of your body's overall resilience. In other words, you've dropped down from 100% somewhere down to at least 50%. And that can happen all at once if the injury is severe enough. But what it can also do, like unpaid compound interest, is it can slowly accumulate over a long enough period of time. And then guess what? You develop some kind of sickness, disease, symptoms, or whatever you're going to call it, seemingly out of the blue. And the reality is this did not come out of the blue at all. This can be very much related to some old kind of issue. Again, weeks, months, years that you never even realized had set the stage and was developing into the way that it shows up presently. Now, none of us have a time machine to be able to go back and to undo these different kinds of injuries when they've happened to us. Nevertheless, okay, the person we are today, this is a reflection of the things and the choices that we made either consciously or unconsciously 10 years ago. The person we're going to be 10 years from now, these are because of the choices that we are making right today, whether consciously or unconsciously. So right off the bat, even kind of at this halfway point of the video here, I would ask you, okay, are you either A, starting to experience certain kinds of symptoms, again, headaches, sciatica, vertigo, dizziness, brain fog, concussion, whiplash, whatever it's going to be, are you experiencing things that you're kind of putting off? Because guess what? They are signals. They are warning signs your body's not in equilibrium. Something is going on. And you need to identify what that something is, not just mask the symptom, because guess what? It's otherwise going to continue to evolve, and your negative momentum is going to continue to deteriorate. Again, this is why we advocate so strongly. Always get things checked when you have significant injuries, even if you think that everything is okay. Now, this is also important because at this point in the video, you're probably thinking, okay, yeah, hey, either I resonate with this or you're thinking somebody else, okay, wow, they probably need to watch this information as well. They were in a car accident, they had a nasty fall, something like that, and they didn't get it checked out. And is it possible that what they're currently experiencing, even if there is that time delay, is actually related to that something in the past? It's impossible to prove causality, I will say that. But very, very frequently, problems that we experience, there is a time lag. There is this period in between. And there is nevertheless this connection. If we can identify what that connection is, that frees us up to be able to know what can we do about that in order to improve our quality of life. Now, this question comes up almost all the time. How do you know when you're dealing with a physical injury, how long has that physical injury been there? And the answer is actually simple. It's not exactly the same as carbon dating, but we take a picture and we look on the inside. Why? Because it's what's on the inside that counts, something like that. Our bones, our joints, our discs. These are structures within us that are designed to move. And again, not necessarily broken, not necessarily dislocated, not unstable or anything like that. But when there are offsets, even that slight little amount, what they're going to do is they're going to start to accumulate abnormal physical wear and tear. In the same way that, let's say you take a bicycle, you throw it outside, and you leave it out there for a few days, maybe a few weeks, a few months, few years. Based on the amount of rust that you see, that gives you a good understanding of how long that bike has actually been left out in the rain. So similarly, when we're looking at whether it's an X-ray, a CT, a CBCT scan, looking at the health of a person's spine, emphasis on the health of a person's neck. Why? Because it's an excellent reflection about what's going on from a muscle, ligament, and also a neurological standpoint for a person's entire body. The amount of wear and tear that we see, that is degenerative arthritis, is like rust. And even though we can't necessarily carbon date it, because sometimes a person can have a really severe injury and it causes all kinds of damage in a short period of time. But other people, again, because of genetics, anatomy, their body may have been able to accommodate for that stress in little nicer ways. They could have had an injury a long, long time ago, but their body's actually found ways of compensating really well. One way or another, it gives us a sense in terms of how long ago and how long has your body been struggling with whatever is going on. So what we can do is we can have like a little picture like I have right here where we're looking at the overall health of the bones, and this of course is a little animation. The health of the bones, the health of the joints, the health of the discs. Why does that matter? Well, it's because every level of your spine is going to have an associated electrical wire, a nerve that controls your muscles, your organs, all the tissues, the cells in your body. Every single one of these levels is going to have a nerve. So when and where there might be damage or misalignment that accumulates over a period of time that changes the structure of the bone, changes the structure of the joints, changes the overall curve of the neck, which is going to change the tension along the muscles, ligaments, nerves of your entire spine, kind of something, if you would, like this. This gives us a clear sense about what is going on in your body and if your body is as healthy as it should be or not. We know that if we want to take care of our teeth, what do? It's probably a good idea to go see the dentist. Ideally, 1 or 2 times a year, but at least as a one-off. Why? To make sure that you don't have cavities, because if you do, developing good dental habits so that you might be able to resolve that, but if the damage is severe enough so that you can get the problem resolved, so that you can do better habits so that things do not continue to get worse. But let me ask you, how many people actually look and consider the overall health of their spine, the health of their neck, the health of their electrical system after so many different kinds of physical injuries and ways that we beat it up and abuse ourselves? Again, it's no longer just a matter of the reckless joy of being a child, learning to crawl, learning to walk, learning to play sports, learning to ride a bike, falling off bikes, all of that sort of stuff. Now we have our devices, our computers, our books, our phones, our gizmos, our gadgets, all that sort of stuff, and it's causing us to stretch our head more forward, and so we're actually accelerating the damage. And many things that we used to see for people not until they were in their 40s, we're starting to see this for people when they're still in their 20s. That is not a good thing. And if we understood, again, this is what the big idea is all about, is understanding how is it that small changes that we make now can have big changes in terms of our health, in terms of our vision, in terms of being able to enjoy our future. If we make those changes now, it gives us a much better opportunity to live the life that we really want to live. So that's just a silly little schematic here, but I want to show you a few real images here so that I can highlight to you what I am actually talking about here. So we weren't able to have this person take their earrings out. They had just had them pierced. Otherwise, I always take earrings out when we do films. But what we're looking at, even if you've never studied radiology here before, you'll notice that there's a nice, so this is the person facing forward. So this is the front, this is the back, and this is their neck right here. 7 vertebrae that are forming a nice smooth arc like this. Your neck is not supposed to be straight. It's supposed to have a little arc in it like this. Why? It's because your neck is designed to be flexible, like a spring. When it is injured, either because snap forward like this or snap back, what it's going to do is going to damage the muscles, ligaments, and that's going to cause it to start to stiffen up. Or, as one of my clients said many years ago, fossilize. And as it hardens, as you fossilize and you lose your flexibility, that means then that your margin of error in terms of what your body can experience starts to decrease, and you start to experience more aching, more problems again. Not because you're getting older, but simply because there's an old injury that you never realized that you needed to do something about so that that didn't happen. So that's what I want to show you, is the progression of these things over a period of time. So what we have here, and these are different individuals, so you will notice that there are subtle little changes here, but they're going to illustrate the point and the purpose. So what we start to experience when there's early signs of wear and tear here is this person, they still have an overall pretty good curve in their neck here. But what we start to see is where there is a little bit of narrowing of the spaces, the little dark zones between each of the individual vertebrae. These are the discs. These are the shock absorbers. These are the little cushions that give us the flexibility through our body. So this is what it looks like after the accumulation of about 5 years worth of wear and tear stress. Not enough to where you're even really going to mention much of anything at all on a pathology report, but nevertheless, you can still see some early functional changes. And these people can still be experiencing pain and other issues even at this point. The next level is where we start to see where the neck really begins to straighten out. So you'll notice by comparison here, this is a nice big open space, but then these spaces here are decidedly narrower. And a lot of times when people say, again, okay, you've got arthritis and you're experiencing issues, well, it's because you're getting older. Okay, well, let me ask you this question. Is this area where we see the most amount of damage older than this area down here? In other words, is one bone in your body older than another one? Were you born with like that piece of bone missing and the other one just sort of randomly showed up and that's why it's not quite as old? That doesn't make sense. What it means, because if that was the case, then what we would see is we would see equal amounts of wear and tear all the way through your body. So instead, what this is suggesting and what this is illustrating is that when we see degenerative changes going on in the body, this is a cumulative process. Why? Because that's the area that is under greatest stress and strain. Now, where the problem is, that is where we see the damage, isn't always where the problem is. And by that, as I've explained in other videos, is that we can have the cause and we can have the effect. Sometimes, and most commonly where the damage is down here in the lower part of the neck, it's actually because there is a primary issue that's going on higher up and your body's trying to use the lower part in order to compensate. In other words, just because a person may have pain and other problems going on in their body doesn't mean that that's where you need to focus your treatment. We need to know the difference between cause and between effect. Now, what's also important for me to pause at this point and to point out is that when you have areas of physical injury in your body, your brain is not stupid. It is fully aware of what the circumstance is. And I want you to imagine that something's happened to somebody in your own life where you need to keep a closer eye on them. They might be at risk, bad things have happened to them. You're concerned about them, so you want to keep a close and watchful eye to make sure that they are doing okay. So guess what? Your brain, your neurology, in its intelligence and its wisdom is going to do the exact same thing. Now what it will do is it will actually develop new neural connections in the areas of damage. Why? So that your brain can more closely monitor that area. If it's been damaged, we need to make sure that nothing is going to go wrong in that spot. And the more damage that starts to accumulate over a period of time, again, it's that negative momentum that we're talking about, the more of these neural connections can start to show up. But here's the double-edged sword, is that the more neural connections there are, the more messages also go up to your brain if and when there is a problem that's not being resolved. So again, just because you may have a physical injury but don't experience immediate symptoms, guess what? If this degenerative process starts to occur and that negative momentum starts to accumulate, the unpaid compound interest, these symptoms can start to develop as well. And as it relates to the health of your neck, of your nerve system, there are 3 primary nerve receptors that I talk about all the time. These are your pain receptors. Obviously, they're detecting physical damage. There are your proprioceptors, aka your posturoreceptors. These are essential for muscle tone. So when we say we have constant tension in our neck, in our head, in our shoulders, the neurology is actually all of the neck. It's not necessarily a muscle problem. It could well be a neurology problem, but not to the point where a neurologist says, okay, you need surgery or anything like that. No, it's probably where it falls in the realm of chiropractic, physical therapy, something along those lines there. And there's a third kind, and these are what are known as pressure receptors. These go and they tie into the parts of your brain that are responsible for coordinating your reflexes with your vision, your hearing, your balance, and your equilibrium so that we can operate as human beings in an upright kind of posture. And when there are problems with these particular kinds of nerve receptors, we can start experiencing vertigo, dizziness, brain fog, ringing in the ears, but it can also overload our neural circuitry to such a degree that we can start to experience neuralgias, brain fogs, different things like that. And when you may have a combination of pain receptors and where you may have it with proprioceptors and you may have it with pressure receptors, then we can start to experience really complex kinds of issues. And again, we're trying to figure out what is the origin of all of these symptoms. And it's not always coming from a problem in the neck per se, but it's one of the essential elements that unfortunately, again, people never think to realize that a problem in their neck could actually be showing up in so many different ways. Why? because you don't know the anatomy, because you don't know the neurology, but that's not your job, but also because people don't think that their current symptoms, their current circumstances can be the consequence of an old physical injury that at the time seemed to be just fine. And it's that lack of awareness that unfortunately leads to so much of the pain and suffering that we as human beings can experience. But it doesn't have to be that way once we understand what the truth is, and when we understand that there are alternatives, there are other options, there are different ways. So again, we can't go back and change the circumstances of the past, but we can make the changes now so that we can start influencing and providing better probability, better outcomes for the future. So now we're going to continue along from here. So this one here again was where our neck is going too straight. You're seeing more damage, 10 years worth of accumulated stress. Well, this is what it looks like at about 15 years. You can see still too straight, but now what's happening is that the area between the bones is starting to flatten out. It's starting to wear and tear a little bit more. So instead of a nice, square-ish shaped vertebra, we can see that it's starting to flatten out, and we can start to see wear and tear through the joints in the back. And just because a person might be experiencing or having degenerative arthritis, again, it's not because they're getting older per se, but it's also not damnation that they have to experience pain and symptoms. I mean, some people, they've got absolutely horrific amounts of arthritis, and they say, oh yeah, it's a little stiff in the morning. Other people have a sliver of the damage, and yet they're in agony all the time. Remember what we talked about in terms of how much adaptability your body has, that when you lose that functional capacity, that's what's going to lead to this pain, the messages, the symptoms. Different people, different genetics, different circumstances. We need to learn to stop assigning meaning that when there is that we don't need to act until there's a problem. It's that kind of thinking that unfortunately gets us in trouble. The presumption is if I feel fine, I'm healthy. That is the number one myth in all of healthcare. And if we understood how to better pay attention and stay on top of things, we'd be able to prevent so much, again, sickness, disease, that, who knows, maybe we'd be able to be living a lot better, healthier lives. This is the next level down. So this is going to be 20 years worth of accumulated physical damage compared to our original baseline normal. So what you will see here is, okay, this person's curve overall not too bad, but you'll see there's really starting to get more profound degenerative changes through the shapes of the bone. They're starting to look way more spiky compared to the nice smooth arc earlier. And as you can also see, their neck is actually straight, and then there's a sharp pivot that occurs in that one spot. In other words, body's trying to compensate in this particular case, but all of the force is going to be focused in that one little spot. They also swallowed an earring. Not quite, they didn't swallow it, but they couldn't take the little piercing out. And it was a little piercing on that little part of the ear right there, just in case anybody was wondering. This here, 25 years worth of wear and tear. So now we're talking about where you're dealing with true bone on bone. And when things can and do become pronounced enough, sometimes surgery is needed. Now, one doesn't normally need surgery, and the best surgeons that I've ever encountered all say that I don't like to do surgery for people. They want to make sure that a person has exhausted all other options. They've been to the chiropractor, they've been to the physical therapist, they've tried to manage everything naturally, but they've gotten to the point where, unfortunately, none of that is working. That's the point that surgery is usually required. So this is a person where, even if they may not yet be a surgical candidate, okay, this is a possibility where they might need a disc replacement. And believe it or not, as far as all surgeries go, that's a relatively common one, and you don't ever want to have surgery if you can avoid it, but that's one of the least injurious kinds that you could actually have. People typically do pretty good, but again, better if you don't have to go down that path in the first place. This is what 30 years worth of accumulated damage looks like, and what you can also see right here is a very, very pronounced S shape in the curve of this person's neck. When we have, and I'll repeat, when we lose the normal curve of the neck like this, it's like taking a piece of string and going, but that's your muscles, those are your nerves, that's your spinal cord. And that can cause all kinds of different issues, again, that people never think are connected with the neck. So that string is anchored at the top of your neck, and then it's freely floating all the way down to your tailbone. So if I pulled it like this from the top, guess what? That tension can be experienced down at the bottom, and it's actually one of the ways that a neck problem can actually go on to produce a sciatica or lower back issues or even knee kinds of issues. So I repeat, where the problem is isn't always where the problem is. But if we want to take that just one step farther right here, this is what we're looking at when we're looking at like 30 to 40 years worth of accumulated damage. Not only is this person bone on bone, but we can also start to see now where they have lost a good chunk of their bone density. And this person, unfortunately, they are at greater risk of osteoporosis, about fracture, all of that sort of stuff. Now, I should point out that even that particular individual that I just showed you, they can still receive treatment for their neck. It needs to be very precise. It needs to be very gentle. But until your very last breath, your body never, never, never stops fighting for you. It doesn't forget how to heal itself. It just needs whatever that something is that he or she needs so that she's able to overcome that point of resistance and then work to start to reverse that negative momentum. Now, I think you can appreciate that the longer that a problem has been there, the longer it usually is going to take to be able to reverse that negative momentum. Nevertheless, if you can give the wisdom of your body that little bit of exactly what it needs, you would be amazed the kinds of constructive, positive changes it can start to make. So what I'm saying here is even if you do have huge amounts of arthritis, meaning nothing more than the injury happened in the past, and it's been accumulating that rust and that degenerative damage and that negative momentum over a period of time, your body still has the potential and the capacity to be able to heal. Your next 10 years can still be better than your last 10 years if you're able to identify exactly what that something is and then make that necessary change forward going. So there we go. I hope that that little video here has explained a little bit about the different processes that go on in your body and how and why it is that even though you might experience a physical injury, you don't necessarily experience symptoms right away, but how different symptoms down the track can actually be related to something that had happened in the past. And again, we don't have the time machine, but anything and everything that you would do in order to prevent sickness, disease, and increase your probability to be able to live the high quality of life that you really want to be able to live, then that goes a long way towards keeping you going, living well, staying well, being well, enjoying as many days as you do have. So if you have enjoyed the video, and thank you for watching it all the way through the end here, please do like or hit the like and subscribe. Why? Because it helps YouTube recognize that this is a valuable video so other people are able to find it. Now, if you've been watching this, and again, you're thinking of a friend, family member who would really benefit from watching or hearing this one as well, please do share this video with them. And if we've said something here that resonates with you and thinking, okay, wow, what he's talking about describes me. There's something that, I need to do about this. First thing I'd have you do is I'd have you go to the Blair Chiropractic website. Again, even if you're dealing with degenerative arthritis in your neck, there are still safe ways that you can treat a person's neck to restore their overall quality of life. So if you go to the website blairchiropractic.com, you'll be able to find a directory of upper cervical Blair chiropractors around the continental United States and around the world who do this same kind of work. Now, if you want to reach out to me personally, you're in the Spokane, Washington, or the Eastern Washington, Northern Idaho areas, certainly I'd be delighted to hear from you and help you in any capacity that I can. So what you can do there, you go to my personal website, which is drjeffreyhanna.com, where you'll be able to find all kinds of other blog articles, videos about a number of different conditions, all related to the neck, what we do, how to be able to help you out as well. And you can click a contact me form. It goes to me direct. And that way we'll coordinate a little time where we could just have a little bit of chat, find out what we can do to help you out. And if that makes sense, if it resonates with you, then what you'd have you do then is reach out to us at our clinic. We're part of the team at Clear Chiropractic. We've got 2 offices up in the north in Mead and in the south at South Hill. And you can reach us at 509-315-8166. Mention that you saw this video, and we'll be certain to coordinate and be able to get the best possible care for you, from myself and from the entire team. So number again, 509-315-8166. Thank you again for watching the video here. Sincerely hope you found it useful, valuable, and that you've enjoyed it as well. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, and stay well. So till next time, take care. Bye-bye.